even I think not stable compared to my home. Okay, so if I'm lag, or the line affected, just alert me. Okay.
Okay, sure, doctor.
Okay, so let's start. Just a moment. Okay, so can you see my slide, students?
Yes, doctor.
Okay, so the first question is, what are the advantages and disadvantages of doing flank OSHI compared to the traditional midline methods? So it is listed in these papers. I think I uploaded into the folder that must read. If you check, okay, if don't, then I can re-upload again. This is so let's start with the indication. So when we want to perform a flank approach is when, like I said before, the mammary is enlarged, okay? Or it has a mammary-gland hyperplasia. So in this case, the vessel is very engorged and huge. So we don't want to cut into them, okay? So when anything that deal with lactation or mammary, you want to do a flank approach, okay? And then so contraindicated, you don't want to do a flank approach if the patient is pregnant, if the patient has a pyometra, stress, obesity, or you very young patient. Okay, I only has an experience performing flank approach in 2 species, cats and rabbit. Okay, so I do not recommend you to try on dogs because they are very thick. When they're on lateral recumbency, they are thick, okay, compared to cats and rabbit. Okay, so what is the advantages of flank approach? So the evisceration is less likely, okay, and then and you able to observe the incision from a distance. So the disadvantages, is limited exposure to the patient contralateral side, meaning that when you put a patient on left recumbency, this means the right side is on the top. Okay, if you put the patient on left recumbency, the right ovaries and uterine horn will be on the top. It's easier for you to reach them. So the more difficult side for you to reach is the contralateral, which is the left side. Okay, so in the process of getting them, sometimes again you can lacerate, you can damage, you can severe other organs. Okay, and then this one is difficulty identifying a previous ovarian hysterectomy if the patient is not properly marked. So sometimes, especially in this trap, neuter and release, or trap, neuter and rehome program, if a patient, you know, right, for all the cat and dogs that undergo trap, neuter, rehome or release program, they will have this ear tipping, meaning that we snip off the tip of the ear. So sometimes there are cases that staff forget to perform the ear tipping, and when they perform the flank approach, you might not able to see any scar on the midline. So we probably put the patient to undergo 2 times of OHE. Okay, so but even to say so, I also have personal difficulty to perform, to identify a scar from previous OHG, even though it is a midline. Okay, so it is not easy. And then these very cosmetic issues, possible imperfections, or or color or regrowth on the flank. That is possible if the flank area, the flank surgical site succumb a complication. Okay, so at the private outside, a lot of them perform this, and they are very good. They take a very short time to perform it. Okay, so actually, if you ask which one I prefer, it's basically which one you are most confident. Okay, so I personally, I'm not comfortable during the flight unless requested by owners. Yes, I'll do, but really I'll very careful in performing that. Okay, so that's it. Is everyone clear?
Yes, doctor.
Okay, so the second question, for en bloc ovarian hysterectomy, if we remove the whole uterus and cut off the blood supply from the breech to the fetus, how long is the maximum duration which the fetus can survive in the removed uterus before it takes its first breath after being taken out? So this is from the experience of the surgeon, or a general point of view. Okay, I think there's no one like standard research or review of how long, but according to a general acceptance time, is actually the time left from the first clamp and to all the puppies removed from the uterus is basically 60 seconds. So it's very short. 60 seconds mean 1 minute, guys. So before you even want to do the first clamp, you really have to lay out your instrument, your OT teams, your nurse team. Everyone has to be standby. Okay, there's no time to waste. Clamp, cut, pass the uterus to the another surgical team. Cut the uterus, remove the fetuses, and pass the fetuses to the nurses to resuscitate. So general timing is 1 minute. Okay, so if you plan to do this, make sure you have enough team members. The third question, what is the percentage of a male dog or cat born with one testicle, monarchism, and how often do we encounter it in surgery? So dear students, monarchism is the absence of one testicle, meaning that the cat or the dog has only one testicle. Okay, so monarchism is totally different from cryptorchidism. Everyone clear? Please remember this. Monarchism is totally different from cryptorchidism. Monarchism is absence of testicle. Cryptorchidism is retained testicle. Okay? And from these journals, they stated that they are a rare conditions in small animal. And these two writers reported 4% in of incidents, or meaning that 2 in 50 cats. And males reported 0.1% incidents, meaning that 2 in 1,345 cats. So most of the time, we can see that it is more reported in feline. Okay, so in years, I never encountered a monarchism case. Probably vet outside they encounter, but not me in UVH. Okay, so it is very rare. Okay, so this question, are there any major differences between reproductive and urinary surgery between dogs and cats? So really, when you ask these kind of questions, it's very broad. Okay, so who asked the question? May I know what you want to really know about this question? Are there any major? So of course there are measures even between cats and dogs. There are major differences in terms of anatomy, in terms of soft tissue handling, and of course in terms of diseases presentation. Example, you have prosthetic diseases is more presented in dog, and actually I never encountered a cat with a prostate disease. Urolithiasis, nephrolithiasis is more presented in cats. Dog very less. Okay. So I'm not sure what you want this question about, whether from the anatomy point of view or disease presentation. So Mira, please take note. Ask the students what are the major differences from what point of view. Okay.
Okay, sure, doctor.
So question number 5, can we use cauterizer to coagulate the hepatic vessel? Okay, so vessels can is a very broad term. Okay, so vessel can be your large arteries, your large vein, your venules, your arterioles, all those are vessels. So I assuming that this is probably the small arteries and veins. So rules of thumb, cauterizer can provide hemostasis. This is discussed, or this is informed in 3702 hemostasis lecture. So small artery 1 millimeters in diameters and veins 2 millimeters. Okay, so if it go to the larger vessels and arteries, you definitely need ligations of using sutures or clips. We don't want to overuse cauterizer because we know that they can cause thermal injury. When you have this thermal injury, you probably have a poor tissue healing because the burn part will necrotize. Okay, so so you want to use it in a very careful manner, not like every you want to cauterize, you can mix and match with direct pressure, ligations, clamp, and so on. Okay, so the answer is yes, we can use, but have to be judiciously, very carefully used. Okay, and another problem with cauterizer, because when you cauterize, you basically form a scab at the bleeding part. Okay, so the risk is if the scab dislodge, then you're going to have a bleeding or hemorrhage. Okay, everyone get that? So when we cauterize, we basically perform there's a scab or a chart area, but if this part dislodge, example by a higher blood pressure that pulls this scab away, you're going to have a bleeding. So after you cauterize, you really want to stop for a while and see whether the sealing is effective or not. Okay. Okay, everyone clear? So if you want to know 1 millimeters, how big, take your ruler and see 1 millimeters for arteries, and veins 2 millimeters. So they are they are quite like small. Okay. So next, so the student asks, can a C incision be made to remove oral hematoma? What is the significance of making S incision for oral hematoma? So before we want to understand why S or whatever incision is made, you need to know the vessel that run on your ear pinna. So you can see that you want to be very careful. You can see you have this lateral auricular vein, you have this medial auricular vein, lateral auricular arteries, intermediate and also medial. Also, you have nerve, caudal interarticular, and all these nerve. So there is a reason why this actually is not, it's not like significant. It's basically you want to confine your incision in the middle here. Okay, it's either S or you can do it straight. A C, I never do a C, but I think C you're going to severe a lot of vessels, okay, veins and arteries. Okay, so just a logic, please confine your incision in the middle here, okay, like this. So you can do a straight line or an S line, it does not matter. This incision is to provide a drainage for the hematoma that already accumulate inside this area. Okay, so the only things that that matters is actually we prefer to remove an oral hematoma that I think people in the field call mature hematoma, meaning that the hematoma that already formed for like, or already the bleeding is already stopped. Okay, so if this is still actively bleeding oral hematoma, you probably want to wait. Okay, because once the blood clot form, the bleeding will stop. So it make your post-op management easier. If you remove it while it's still actively bleeding, um you probably a little bit more messier. Okay, so when this is clot is form and stop the bleeding, okay, so you it's easier, you can just make an incision, remove the clot, and place these sutures along the incision line. Okay, so basically is you want, if you want to avoid the vessels. Okay, question okay, this is question number 7. For cystotomy, what factors do we consider when deciding to incise on the ventral wall or dorsal wall of the bladder? So ventral or dorsal walls. Okay, so according to the books that I just quote, ventral bladder wall incisions are often recommended because dorsal incision are thought to predispose to complication, a result of decreased visualizations of the anatomic proximity to the ureters. Okay, so because your ureters enter to the bladder on the dorsal wall, so you want to avoid, actually, if you cut into the dorsal wall, if you are not careful, you can accidentally injure your ureter. Okay, but it does not mean you cannot do incision on dorsal wall. Okay, there are some times that I do incision on dorsal wall. Okay, so cystotomy on ventral aspect, it give you a better exposure at the trigone area, which this is very true. So if I have a stone or cystolis patients, I definitely will choose a ventral aspect because I really have a very good exposure. I can really feel the trigone area with my fingers to check for any trap stone. Okay, guys, for urolith or cystolith, sometimes they are not free floating in the urine. Sometimes they actually embedded in the mucosa. Okay, they are stuck inside the mucosa. So you need your finger must able to feel every single corners of the mucosa of the bladder. Okay, you don't want to leave even a single stone accidentally. Okay, that's why post-op radiograph is mandatory. Okay, so basically it is okay to do on ventral or dorsal wall, but it's based on your case by case. Okay, let's say example, if the ventral wall is too much damage or a very inflamed cystitis and the dorsal wall is not that much affected with inflammation, then you probably want to choose the dorsal wall. Okay, it's really go case by case basis, but the general point of view is people want to do a ventral wall incision. Okay, so it's question number 8 is a ovarectomy commonly applied in our country. It is done for sterilization purpose only. Okay, so in Malaysia, or I would say in UVH, okay, I'm not sure what happening outside in private. We are not doing OVE except for research purposes, okay? So I would say it's not common, but it's actually not common in UVH. I'm not sure again what is practiced outside, okay? However, OVE was associated with shorter incision length, shorter anesthetic and surgical time, lower post-operative pain score, less surgical stress response compared to ovarian hysterectomy. OVE can provide the same health benefit as ovarian hysterectomy, except that OVE does not prevent cases like high, because you in the future. So I encourage owner, or I please, yeah, or you have. So if you can eliminate the problem for the patient as early as you can, okay? Because probably the setting, the mindset of the society is different, okay? Probably in overseas, owners are very sensitive. If the cat, if the dog not looking very well, they'll probably quickly bring to the hospital. But in Malaysia setting, I encountered especially case like uterine neoplasia, they can leave it to grow as huge as a tennis ball, or the pyometra that almost ruptured, then they bring in. Okay, so those increase complications, and I don't want to deal with it. If I can prevent it out um, at the first encounter with the patient, I will straight away offer ovarian hysterectomy. Okay. Okay, what are the drugs which will not pass through placenta commonly used in cesarean sections of the dog? Okay, so basically all the drugs I think able to pass through, because 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 all the drugs commonly used.
Sorry, doctor, sorry to interrupt. Doctor, sorry, your voice is
Yes,
breaking. We couldn't hear what you were
okay.
saying.
So which question? Which question?
Sorry. From this slide, doctor, number 9.
Okay.
Doctor, sorry, are you speaking because
Pass through the
we
placenta.
Doctor, sorry, you're breaking again.
Hello, can you hear me?
We can hear you, doctor, but
Hello?
you're still a little bit breaking.
Okay, we wait for a while. Can you hear me?
Okay, can, doctor.
Can Okay, I repeat again. What are the drugs which will not pass through the placenta commonly used in cesarean sections of dogs and cats? Okay, so this part I have requested anesthetist Dr. Ubek to come up with a more complete answers. But just briefly, I think all drugs will pass your placenta barriers because it's blood. Okay, even your isoflurane can cross the placenta barrier. That is why you see in cesarean section, it has to be done quickly. Okay? When the mount or the dam is down, each time.
Doctor, I'm very sorry to interrupt again, but doctor's voice is breaking again.
Okay. Can you guys hear?
Yes, okay. Yes, doctor, better.
I think your side also breaking actually. When you guys talk, the can you hear?
Doctor, sorry, we cannot hear you. But other students say that they can hear my voice, but doctor's voice is breaking a little bit.
Okay. Your line also breaking actually. Okay, let's break for 5 minutes and let's break for 5 minutes and we try again. Okay.
Okay, sure, doctor. Sorry, doctor.